Hi, I'm Dr. Jennifer Leoniak. I'm the Director of Infection Control at Emanuel Medical Center. So as a Director of Infection Control and at Emanuel Medical Center, we've prepared for the COVID crisis and COVID pandemic. We've been having daily meetings and having coordination with all departments for about 5 to 6 weeks. Initially we limited, and now we've stopped visitors coming into our center. As we have new information about people that are asymptomatic that can transmit the virus to other people, it's important that we work together to protect our employees, our staff, and our other patients. We've taken measures to stop people from coming into the hospital by screening them to see if they're having symptoms or if they think they have COVID. They are then being separated from the general people that are coming in for other reasons, that they're separated so that the people that are coming in for other reasons are not in any harm's way of getting infected. We then screen them either outside of the hospital if they are stable, or if they're unstable in a separate unit or separate place with different gear. We separate all our patients so that they're not in harm's way. We're also wearing masks to protect our patients and to protect each other. The masks prevent cough and the droplets from going from over 6 feet. It doesn't protect you if you're standing right next to me, but it will protect you if you're about 6 feet away. The mask is not preventative for us to get COVID, the surgical mask or cloth mask, but it is preventative for us to give it to other people if we don't have symptoms and we don't know that we're infected. We've taken COVID seriously from the beginning. From people that are driving by, maybe wondering why we were wearing the outfits and why people were standing outside in tents, it was because we knew it was coming and we wanted to protect and prevent spread within our hospital facility. What I can say about COVID is we don't know all the information, and you may be seeing on the news some highlights or bullet points, but the truth is we don't know everything about the virus, and we have to take the most precautions that we can until we have more data. Nothing can replace hand washing. Hand washing for about 20 seconds after you get back from a grocery store, before you touch anything in your house, would be very important. Making sure that you protect yourself, because the virus stays, what we do know is the virus does stay on surfaces for up to 3 to 4 days, depending on the type of surface it is. So if somebody went by and touched, say, a grocery cart, and then you go home and eat your food, you then can transmit the virus to yourself. So it's very important that if you have to go out to the grocery store or other major things like going to a doctor's facility, that you are protecting yourself. Regarding testing, the initial rollout plan at the hospital was to be able to test the patients that are outside of the hospital, and we were hoping that we would be able to do a drive-through where people can come and get tested. However, limited supplies and limitations of reagents that were being shipped to all hospitals over the country we've had to change policies and procedures on a daily to maybe an hourly basis, depending on what supplies we have available. At this time, it's most important that the patients that are inside the facility that are the sickest are the ones that are able to get tested. Employees and first responders should also be able to get tested. Those are the people that are most important right now to get tested and be able to get their test results back. People that are having symptoms or think that they have COVID, if they are not having significant shortness of breath, they should shelter in place at this time. As more supplies come in, we will be changing our policies and procedures, but at this time it's recommended that the test and the limited supplies that our country has goes to the people that are the sickest. It's important not to underestimate the virus just because your age or that you don't have other comorbidities. We do not have antibodies to it, and it can affect anyone. So what we can expect is that as more people are exposed, healthcare workers, first responders, people that are going out of their house and not limiting their exposure and having to go to work and are exposed to other people that are asymptomatic and can transmit it, we can expect our numbers to go up. Our numbers have gone up. We initially had 5 about 3 weeks ago, and now we're at 90 for the county. Turlock itself has, I believe, 5 at this point that were positive, but that doesn't mean that there's only 5 people in the county that are infected, or in our town that are infected. Because of the limitation in supplies, we do not know the actual prevalence of the virus in our county and our town. The hospital has taken the most precautions possible to protect our other patients that are coming in for non-COVID reasons. We are wearing masks. We are separating the people that we could possibly or potentially have COVID from the other patients. We are having the nursing staff work only on those COVID patients and having dedicated people work specifically with those groups. The non-COVID patients should feel secure that our hospital has taken the most precautions to protect them. And if they are having life-threatening illnesses, they should feel comfortable being able to come into the hospital.